Hi guys, John here with Activate Your Best Health. We have Dr. Saddoris on today so that we can discuss some cutting edge therapies that aren't normally considered traditional Western medicine. We're going to be diving into some peptides today. If you guys like any of the therapies that we're talking about today, feel free to click the link below and you guys can access the free consult link to schedule time with either one of us, or go ahead and click on the intake form if you want to go ahead and take the plunge. 41. So we're going to get into some sexual function and libido first. We're going to get into growth hormone optimization. Then we're going to move into one of my favorites, the tanning and metabolic enhancement category, which is pretty cool. And then we'll get into some healing and regeneration. So let's dive right into one of our most popular peptides, PT141, also known as bremelanotide. Dr. Saddoris, can you explain what makes this peptide unique in the realm of sexual wellness?
Yes. First, before I start on peptides, I just want to let you know that, a lot of these are natural products that stimulates our natural system in ways that improves in performance. As we age, these levels drop. So a lot of times we need to supplement to get those levels back up into a more normal range so it slows aging down, but also improves function and how we feel. And the PT is so important because, unfortunately, as people age, their sexual desires and their sexual ability dramatically drops. It works both on the physiological part, which is the part mechanism of your body that over time kind of decayed and just hasn't become like it was before when you were younger. And then also the psychological part, which is dealing with the part where you mentally start having performance issues or you start having lack of desire, of how that affects how you feel about yourself and your well-being. So this medication works differently than if you're just taking something to help for sexual performance, like Viagra, those products that are out there that just increase blood flow, but it has nothing to do with arousal or interest or enjoyment. This product works on what we call neural activation. It's actually stimulating the receptors in your brain, and this increases the sexual desire through the hypothalamus, which is part of the brain. So when it stimulates it, then it activates those hormones that enhance natural arousal. It also works independently of the vascular and helps with maintaining erections. But even on its own, it does help improve erections and also physical desire.
I do love the fact that it does hit it from the desire side, and it seems to work really well in women, which is a big deal since, there's not really a lot in that space, it seems like, for women.
Definitely. Being a woman, I understand this completely. uh, you know, um, unfortunately, as women's hormones change, especially as their estrogen levels drop and they get vaginal dryness and they get discomfort, I have a lot of women come up to me and say, I just don't really want my husband to touch me. I just don't have the interest. It affects the relationship because sexual interactions is really what brings emotional bonding between people. One thing about this product is that it's been FDA approved for pre and menopausal women, and they call it HSDD, which is hypoactive sexual desire disorder. And it is this very common problem. So it improves the arousal response. And this is, what we call foreplay. Women, because they do tend to climax a lot slower than men, this is a very critical phase in activating sexual desire. It also reduces the anxiety about an intimate encounters and definitely improves the orgasm, but also the intensity of the orgasm. I think the other part in men, they are much more involved with anxiety about the intimate encounter, especially if they've had some unsuccessful responses that they get aroused and then it suddenly is not there anymore, or the libido is decreased and with a partner that has an increased desire. So just because you can have the erection doesn't mean that you want to perform it, So it does help with definitely the desire and performance anxiety.
Awesome. So I like how we kind of covered that on both sides, both men and women. So now I guess we can kind of bridge over to optimal dosing protocols. We want to make sure that we're giving you guys a lot of information. So even if you guys don't go with any therapies here with us at our clinic, My Body Health and Wellness, you'll at least know general information that you can approach your physician with to make sure that you're getting the optimal effects.
Yes, I think it's very critical to know proper dosing. On this product, starting dose is 1 milligram, which is 1,000 micrograms per use. And it's so important that on this, because it is associated with sexual desire, performance, that you want to take it about 4 to 6 hours before your anticipated activity. It takes time for it to get to the brain and for it to release the chemicals and to get it into your system. And so it's not one of those ones you take it and you are ready to go right then. It just doesn't work that way. It is given either as a sub-Q injection, usually in the abdomen, or it can be as a nasal spray. And like anything, if you're excessively using something, your brain can develop tolerance to it. So the frequency is recommended not more than 2 to 3 times per week maximum. And then duration effects really varies from person to person. They say 6 to 72 hours, but I think optimal dosing, especially when you're starting out, you want the optimal dose because you want to make sure it works so that you get the confidence in it. So the 4 to 6 hour interval is the best. And then also, again, to reduce the brain from developing that tolerance, you want to cycle it. Maybe use it for 8 to 12 weeks on, and then give yourself a month for your brain to reset. So the other thing is side effects, or how do we maximize it? If you take it on an empty stomach, it does help reduce some of the side effects of some mild nausea that you would get. You want to make sure you're drinking a lot of fluid because, sexual intercourse is a cardiovascular exercise, and you need a lot of fluid to help maintain your function. You're going to sweat. Always start with a lower dose to assess your response because every person is different. And then because it is a cardiovascular event, you can get flushed because you're increasing your circulation, and that can also increase your blood pressure. We certainly don't want to give you a heart attack over these things. You need to see a provider that is knowledgeable in not only the dosing and the side effects, but also the general medical health to make sure that the products are safe for you and that it will be effective for you and that will try to reduce any unknown or willing consequences of taking something on your own, thinking, oh, I can do this myself, and not realize that maybe you're not the best candidate for it.
Awesome. Now comes the fun part. Let's discuss something super interesting for me personally, stacking protocols. What combinations have you found to be most effective?
I think the one that's probably the best is the PT-141 and the oxytocin stack. Oxytocin is associated with joy and happiness and pleasure. It is something that, when you're doing something you really like, you get this extra kick inside. That's what that hormone is doing in your brain. It reduces depression, anxiety. It gives you a worldview of positive outcome. Enhances your emotional connection to your partner. With the PT-141, you take the 1 milligram about 4 hours before. And then the oxytocin is a much shorter acting product. And so you want to only take it 30 minutes before you do the dosing.
Yeah, that's probably my favorite combination as well. It's the oxytocin.
Okay.
Another stack that you are a fan of.
Yes, I think this one I like for men. There is this PT-141 plus citrulline stack. And this citrulline acts just like Viagra, Cialis, because it does increase blood flow through the penis to increase the erection and the firmness. Its enhanced blood flow gives you better endurance, so it's not like it suddenly drops on you. Gives you improved stamina. You do have to be wary because this does act like Viagra or Cialis in the sense that if you happen to have chest pain and you take a nitroglycerin, it can bottom out your blood pressure and you can sometimes die from that. So it's very important that if you do take this product, let your partner know. But the dosing is PT-141, 1 milligram, and you take it that 4 to 6 hours before. And then the Sermorelin, again, it's a shorter acting product than Viagra or Cialis. So you take it 1 hour before.
Awesome. I know another one that we're going to be touching on later too. It's another peptide that we're going to be covering, and kind of the Barbie peptide that I mentioned earlier. I know that's a pretty popular stack to go with PT-141 as well.
Yes, this is going to be the PT-141 plus the Melanotan II stack. I think the interesting part is that a lot of people were using initially for tanning, but they found the unusual side effect of having sustained erections.
So unusual.
So unusual, right? And because of that, became, wow, this is a great combination, right? And so it doesn't on its own, though. So that's why it's a great combination to use with the PT-141, because that does overcome that decreased arousal that just using that product on its own. It does enhance skin tanning. It does improve mood. And so this is kind of nice that both of these products can be administered at the same time. The PT-141 is 1 milligram and the MT2 is 250 micrograms.
So now those are some pretty incredible stacks. We kind of threw a lot at you guys there. Let's go ahead and switch gears and get into growth hormone optimization. So this is probably going to be a pretty popular segment here for a lot of people who are wanting that extra edge, or maybe something that they can add to their TRT. It can work really well standalone or on top of Sermorelin. Pretty fascinating peptide that's truly revolutionizing how we approach growth hormone optimization. Dr. Saddoris, can you explain why this peptide is so significant?
You know, as we age, our natural growth hormone drops dramatically, and that affects our quality of our life. So Sermorelin, what I love about it is, one, it has extremely very minimal side effects, and it actually works on your own natural pathways. It stimulates the pituitary gland to release the natural human growth hormone. When you take it properly, you want to mimic your natural cycle so that you can get all the benefits that you're just getting a little higher level than you normally would produce, to get it more into the range in your 20s and 30s. Because that's when you were at your prime optimal state. Your muscles were strong. If you did overdo it, you recovered very quickly. Your body was elastic. It didn't tend to get as injured or fractured or weak. You had energy, stamina. You didn't have the weight gain issues that you get as you get older. And this is what we want, is to get you back into prime metabolic function. So how does it work? It works by doing the natural pulsatile growth hormone release, and that means we take it at bedtime. That is when we normally start releasing growth hormone, is at nighttime. So we want to mimic that same response, and it restores our naturally declining growth hormone as we age. Because as we get age, we get more fragile, we get more weak, our memory declines, our strength declines. I mean, there's even one study showing your grip strength tells you kind of what your age lifespan is going to be. I mean, that's kind of scary. And so, these have all these benefits. It makes you have lean muscle, not fatty muscle, but lean muscle that is very slenderizing. It reduces your body fat, especially in the abdomen. One of the benefits I think people that will first notice is improved sleep quality. When you sleep, we go through different phases of sleep. We have a restorative phases where our body is getting recovered and strengthened and repaired. And so it's allowing all of those phases of sleep to be back into a normal state. And when we're under stress, which who isn't under stress these days, those sleep quality markers are dramatically impaired. It also helps with recovery and healing. A lot of people don't realize that our immune system is so important, and the growth hormone is needed for that process. Reduce, infections, reduce incidence of cancers, makes your skin more elastic, so you have a younger, youthful appearance on your face, but it's your whole body. And then, of course, our bones get weakened as we age, and it improves our bone density and makes them stronger, so we're less likely to have sudden fractures. and just increase generally vitality of just feeling better and energy.
Definitely. These benefits are pretty incredible. It's almost like the fountain of youth drug right there.
Definitely.
Can you detail the optimal dosing protocols?
Yes, I mean, there is a range, and I always say, if you're older, older meaning like maybe 60 or older, you may want to even start a little lower initially and go up. But the standard dosing is between 200 and 300 micrograms daily. And this is given in sub-Q. Again, you want to do it at bedtime on an empty stomach because you want all your energy to be focused on repairing rather than digesting your food, right? So it's not because of nausea, it's because of the way your metabolic process is going on. And then you can go up to advanced doses of 500 micrograms daily. Typically, we don't want to go higher than that because we want to maintain our normal physiologic responses and maintain that pituitary and hypothalamic axis. And you do tend to cycle it, again, to reduce tolerance. And it can be 3 to 6 months with 1 to 2 month breaks between the cycles. And then there's timing. No carbohydrates 2 hours before because insulin's released then, and insulin turns all your food to belly fat. But we're taking the growth hormone to eliminate belly fat, so we're kind of competing with those things. So don't eat 2 to 3 hours before you take it. And again, at bedtime. And there are some combined supplements you can take to enhance the effects.
So yeah, let's go ahead and dive into some of the stacking protocols. What combinations have you seen that produce the best results for people?
Yeah, I think really the best results is using Sermorelin with CJC 1295. Sermorelin is a short-acting response, maybe 2 or 3 hours at the most. The CJC 1295 has a much more sustained response. A lot of bodybuilders really like this because it really does enhance the muscle growth that you can get, the fat burning, and because of its sustained results, you just feel better all day long. I think that's probably the best combination.
Did you mention the dosing on that specific
Sure,
stack?
I'll give that to you right now. So usually you dose Sermorelin 200 micrograms. And at the same time, you give yourself a sub-Q injection of CJC 1295 of 100 micrograms. And you can give them both at bedtime. It gives you a 24-hour coverage. And like I said, gives you much better results.
Yeah, that half-life is much longer.
Much longer. I mean, you're looking at a 24-hour interval versus 3 to 4 hours. A lot of people that have had significant surgeries, especially like cancers and things like that, it does accelerate their strengthening and getting their muscle mass restored quickly for them rather than taking a much longer time to repair. So I think that has a kind of its own little niche there. There's a lot of peptides out of there. There's a lot of misinformation about peptides. So it's so important that you go and see someone that specializes in it. Most doctors are not familiar with peptides. They're not trained in them. I've been doing anti-aging studies and been doing that for several years. It's important that we're looking, again, at the whole person. So another combination is using supplements with it. Sermorelin with L-arginine. Citrulline is a derivative of arginine, which again works on increasing blood flow. But because it does have an enhanced growth hormone response, and L-orthanine also supports growth hormone secretion. So these are things that can kind of bump up the dose a little bit or maybe enhance its effects a little bit more by improving circulation and distribution of a hormone. Zinc is always important for hormone production, and vitamin D is like I call the master. I should call a master hormone. It's involved in so many cellular functions that you never want to be deficient in vitamin D. But it optimizes hormone function, but it also helps your immune system. I mean, it just has so many benefits, and so you never want to be low on that.
Yeah, that's one of the things that, I really started adding recently. Specifically, I take now 5,000 IUs a day. Now, granted, any vitamin D3 is going to be, better than none, but 5,000 IUs is kind of the standard from what I understand. So now let's get into the
Well,
safety
before you get,
considerations. Oh, go ahead.
yeah. So for monitoring, some people say we should check IGF-1 levels. That's an insulin-like growth factor. And our problem with measuring growth hormone is the hormone itself levels are fleetingly picked up because they're pulsatile. They vary throughout the day. So they're really not giving you an overall picture. I don't know if a lot of people really check that, to be honest with you, but it is a measure that can be done if wanted to. I think your measurement is really going to be how's my muscle mass doing, how's my belly fat doing, and how am I feeling is probably going to give you a more ideal image. You always want to make sure your thyroid's functioning well. Cortisol levels also cause you to have problems, and those can be elevated with depression, increased stress, and there are some conditions that have elevated cortisol. And you do need cortisol to help produce your sex hormones as well. And then checking your body composition changes, meaning what is your waist measurement doing? What is your muscle mass doing? They have these fancy scales that can actually tell you what your percentage of body fat is and what your percentage of muscle mass is doing. And those are helpful to see if we're having the results that we want. One thing is contraindicated is if you have active malignancy, you don't want to stimulate those cells to grow faster. And if you have diabetes that's uncontrolled, if your blood sugars are high or your hemoglobin A1C is not normal, if you have intracranial hypertension, that can lead to a massive stroke because you get fluid retention, things like that. And again, always pregnancy or nursing. Typical side effects, sometimes you can get some injection site irritation, maybe a little redness. Sometimes your joints may get a little achy or muscles. You do have some water retention that tends to go away over time. And again, it does increase blood sugars. And sometimes you can get headaches. And those usually are temporary due to the fluid retention. Because a lot of people that are prone to migraines, when you have fluid retention, it can trigger migraine headaches as well.
Gotcha. Well, that was a very robust explanation of the growth hormone secretagogue Sermorelin. We're going to probably cover one more segment here, and this is going to be the tanning and metabolic enhancement one. Okay. So now we're going to get into the quote unquote Barbie peptide section, right? This is probably where a lot of women are going to start perking up and paying attention. Let's discuss Melanotan II, a pretty incredible peptide. It's pretty fascinating to me just because of all of its widespread effects. A lot of women seem to love it. It's gained a lot of popularity recently. It's known for not just its tanning effects, but it also has multiple other benefits. Dr. Saddoris, can you break down what makes this peptide so unique?
Yes, Melanotan II, which is called MT2, is a synthetic analog, and it actually stimulates alpha melanocyte. Essentially, it is trying to stimulate the cells that produce melatonin in your cells. And it has multiple benefits besides tanning. When you have darker skin, it does protect you from UV radiation. It does have effect of appetite suppression. So for some people that struggle with their appetite, this has a natural way of reducing that. It also activates the sexual function through the MC4R.
Okay.
So, and it also gives you even tanning. So you're not just having it just in certain areas where you've been sun exposed. And it does reduce burning. So skin burning increases skin cancers, and you have a faster tannin response, and it lasts longer.
Now, the interesting thing about this peptide is you aren't just going to take one dose. This one you have to go through phases. So there's a loading phase and a maintenance phase. Can you kind of get into that?
Sure. So usually the loading dose is the first 2 to 3 weeks, and usually it's 250 micrograms daily. And then you can increase up to 5 micrograms as tolerated.
500 micrograms.
Or 500, I'm sorry.
Yeah, there you go.
Apologize that. And gradually increase to 500 micrograms as tolerated. And I think it also depends on how much of a tan that you want also. And they do want you to have some UV exposure, 5 to 10 minutes, 2 to 3 times a week, which isn't prolonged, but it does activate you to produce more of the pigment. And then when you get into the maintenance phase, you don't need to do it daily. It's going to be 2 to 3 times a week, anywhere from 250 to 500 micrograms. And then the administration tips is use it sub-Q, and they say it usually works best before you go into UV exposure. Again, because it's stimulating those receptors. If you have nausea, if you take it at night, that does reduce that. And it is important that we stay hydrated. This does work systemically, increasing blood flow and things like that as well. And so it's important that we stay hydrated. You can also start with lower doses to assess your tolerance. If you're a person that's real sensitive, then maybe start with a lower dose and you can just gradually increase as needed.
So one thing here that I really want to double back on is, since there are 2 phases here, there's the loading phase and the maintenance phase. I think you kind of gradually touched on it, but I really want to drive this point home for people. It is a scenario where you can kind of adjust how tan you're wanting to be by how aggressive you are in the loading phase. And then that maintenance phase is just meant to kind of keep you there. We'll kind of move into the stacking protocol. So we already covered, a very popular one, the Melanotan II and PT141.
Yes, and I think this is just adding some natural products out and using L-tyrosine stack. Tyrosine is a natural amino acid. It affects the dopamine, the norepinephrine, the epinephrine. And so it really has a huge effect on how our body is functioning. It does improve tanning results, but because it affects the neurotransmitters, it improves mood. And usually the dosing is NT2 250 micrograms, and then you use the L-tyrosine 1,000 to 2,000 milligrams. Usually take it in the morning. The other stack, which is more comprehensive, is again using the PT2 and then the vitamin D. L-tyrosine with astaxanthin, which is something they use in a lot of the vitamins to help prevent macular degeneration in the brain. Another powerful antioxidant is glutathione. Also, methylene blue is also a powerful antioxidant.
Awesome. All right, now let's get into some potential side effects and then contraindication.
Yeah, and the side effects kind of depends on what combination you're using. Facial flushing can occur, the nausea, increased libido, and appetite suppression. And then it can make your freckles darker and your moles darker because you're increasing pigment. And the monitoring is so important. Regular skin checks. You really need to have your moles examined, blood pressure monitoring. And it's very important you do not get dehydrated because that can affect your kidneys and also how your cells function. The biggest contraindication is melanoma, uncontrolled hypertension, pregnancy, nursing. I think ways that you can reduce side effects or risk is always start with low doses. And you need to monitor skin changes, see a dermatologist, and then proper UV management, making sure in the initial phases that you're not doing excessive tanning.
Awesome. Well, let's see. Are there any specific tips for optimizing people's results while on this compound?
Yeah, as you mentioned before, make sure you do the loading dose. And the loading dose is going to be determining your tanning level that you want, right? So, there are a lot of people may not want the 500. They just may want just a glow with it, right? Or some of the protection. Some people want to have very dark skin because if they're doing bodybuilding, it just shows their muscles more and their definition. And then consistent timing of doses and the gradual UV exposure, especially in the loading phases. Skin monitoring, as I mentioned, and you want the hydration.
Oh, go ahead.
Yeah, so it really needs to be personalized because each one of these compounds can be adjusted, tweaked to make it more individual for you and your needs. And so it's so important that you see people that understand these products, know the side effects, the benefits, and how to dose it and how to monitor it so that you can get the optimal benefit that you have.
Definitely. Awesome. Well, thank you so much for your time. We're going to be getting into, like I said, the healing and regeneration segment next time, and then getting into the cognitive enhancement part as well, which I think is a pretty cool segment. We just want to make sure you guys are as prepared as possible so that you can ask pointed questions so that you can make sure that providers, even outside of My Body Health and Wellness, can give you the best possible care and make sure that they're aware of certain things. Feel free to subscribe to the channel. Click the link below as well if you guys like this information and want to set up a free consult with either of us. And then we also will have the intake form if you want to go ahead and take the plunge and get the ball rolling on therapy. Well, thank you again for tuning in, and see you guys next time. Bye now.
Bye.